Well, hello everyone. Welcome to our February edition of Seniors Be Well at GRPL. Um, this program is provided for by a generous grant by the National Library of Medicine, and the library, we're really happy to be able to host it. And we're able to get this grant only with the great effort of Mercy Health St. Mary's and the great doctors and residents that work there. So for this session, we're going to be speaking with Dr. Sarna Becker. And Dr. Becker went to medical school at the Michigan State College of Human Medicine, and she is from all the way in Washington. So welcome, Dr. Becker, from there. And her professional interests include obstetrics, sports medicine, and global health. So, and why she chose Grand Rapids for her training in particular is that Mercy Health offers a unique combination of academic and community medicine with an exposure to diverse and underserved population. And she likes to, in her spare time, do track and field, raising 4 kids, which is a lot of work, anyone can tell you, and improving healthcare and housing access to vulnerable populations. And the title of her talk this month will be about grief, stress management, and mood. So, Dr. Becker, thank you very much, and looking forward to a great and enlightening chat. So, thank you.
Thank you so much for that introduction. It's really a pleasure to be online. My background is in education before I went to medical school. So the virtual format, I empathize with all of you and with our teachers, especially out there who are continuing to manage both virtual and in-person formats at the same time. I'm going to go ahead and try to, I want to be able to switch back and forth between being able to see just me on the camera and then also just with the screen. So I'm just going to switch over a little bit to some slides that I have prepared today. So I'll be there. So bear with me as I switch back and forth a little bit here. Okay, so as was mentioned in the introduction, go ahead and get this started here. I am currently at Mercy Health here in Grand Rapids at St. Mary's. As residents, we do a number of rotations between our different hospitals in the area. So we primarily are in St. Mary's on the adult floors, but we also are over at Helen DeVos Children's Hospital. We do some time on the OB floors, the obstetrics floors over at Butterworth. And we also are in the community in outpatient clinics. You might see us at the Waggie Center. And right now I'm on a rotation where we rotate between different nonprofits within Kent County, including the health department, as well as this virtual opportunity to speak through the library. So this is a joint venture between the Grand Rapids Public Library System and Mercy Health, and also with money from the federal government that I'll mention just a little bit later. So we're very thankful for that grant sponsorship. As this is a series focusing on seniors, I wanted to start by just talking about what is a senior? How do we define that? And how does that fit within our population as a whole? I'll give you a little bit of background about myself as well. So currently about 22% of the United States population is at the age of 17 and under. I currently have 3 of those in my own household. And then there's the bulk of our population in what are called the middle years. So ages 18 through 64, which is a pretty wide lifespan. And then ages 65 plus, 17.3% of the population, which in the United States, I calculated that to be over 57 million adults. So a very large proportion of the population. And this is how we would typically define seniors, but that's not a hard and fast age cutoff. We're going to see a short video a little bit later from a movement that's here in Western Michigan that is called 60 Strong, and they are geared toward older adults beginning at age 60, which from my position currently in the middle years does not seem that far off. So I'm just thankful to be able to speak to each of those different age groups, but specifically to seniors today. So as was previously mentioned, the topic that I want to address today is called grief, stress management, and mood. And I want to start by just defining each of those terms. We have a statement in medicine that says, as the arteries grow hard, the heart grows soft. And I think to me that encompasses both the emotional and the physiologic aspects that can be associated with aging and our experiences of grief, stress management, and mood, which is that throughout our course of life, we do go through physiological changes, hence our arteries sometimes grow hard. But we say perhaps from an emotional perspective, our heart grows soft. And these experiences that we have as we go through the different phases of life, which really encompasses the scope of family medicine, of which I am a part, as we go through these different phases of life, we are changed, not just physiologically, but we're changed from our emotional, our mental, and our spiritual perspectives. And so each of these terms, grief, stress management, and mood, encompass both the emotional and the physiologic portion of what we want to address today. So first, I'm going to talk about grief. Grief is an emotional feeling as well as physical symptoms that are associated with loss. And as we'll talk about in a minute, that loss can take many different forms. Stress, as opposed to grief, it adds an additional layer of a feeling of being overwhelmed. And so stress is something that disrupts our normal homeostatic balance. By homeostasis, I'm referring to a dynamic equilibrium that exists within our bodies, where we are constantly changing, but then we are responding to our environment to come back into balance. And that balance can be something as simple as maintaining our body temperature, and in the winters here in Michigan, putting on an extra coat. It can be also an emotional response, that if we're feeling sad or if we're feeling down, that we go and we get a hug from someone who is close to us. And so we are bringing back into balance. And a stressor, whether that's emotional or physical, is something that alters our balance and throws us off kilter. And as humans, we have many mechanisms by which we attempt to bring that balance back into homeostasis. And then the third topic that we're going to address today is something known as mood. And mood is simply a state or a feeling at a particular time. So of these three terms, mood perhaps is the most transient of all of them. But mood, as we'll see, if it persists in one area or another, especially if it persists in a position of stress imbalance, can lead to mental health concerns that we address as medical providers in a broad scope. And by medical providers, I'm using a very broad term for our mental health counselors, marriage and family therapists, our primary care physicians, as well as our psychiatrists and other specialists that you may interact with, our social workers, our case managers. It's a very broad scope of people in our community who address overall mental health. So those are kind of the topics that I want to go through and address today. So I'm going to start by talking about grief. And I just want to pause for a moment, since I'm staring at my screen and I know that you are staring at yours. But I want to pause for a moment and just say that if at any point you do have a question or a comment, please don't hesitate to even just talk right up. We're a very small group this morning. So if I can't see your hand raised because I have the presentation shared on my screen, please go ahead and just speak right up and don't be shy. So I wanted to talk about grief, both in terms of a cycle and in terms of an experience. So many people have attempted to kind of talk about the stages of grief that a person might go through as a result of a sense of loss. And again, that loss can be a loss of health. It can be a loss in the form of a death of someone who is close to us. It can be the loss of something that we never had. It can be the loss of perhaps a parent that we never knew, or it can be loss of an experience, maybe an educational opportunity that we had hoped to have. Maybe we had hoped to go to college and that was never an opportunity that was afforded. Grief can also be a result of ostracization, or feeling like someone was once a part of a group, or they had wanted to be part of a group, but they no longer are. So Dr. Kubler-Ross, Elizabeth Kubler-Ross, is one who established kind of a way of thinking about the grief cycle. People are free to agree or disagree with it, but sometimes it can be helpful to at least form a starting framework for how we might approach a sense of grief or loss from an emotional perspective. So it kind of shows it as a little bit of a roller coaster here that starts out with denial, which is when, especially in a situation where the onset of grief might be sudden, that there's kind of an avoidance of that feeling, or even the physiological responses of shock or fear. And someone might be in a state where perhaps their responses are not what they would otherwise expect. That can move then into anger, which is where someone starts to feel frustrated, irritated, or anxious about what this new event or this loss is going to mean in their lives. It's very common during that phase to look for someone to blame when that grief is intense and when that loss is feeling fully realized. Then we get into the point where other people start to become more involved in the grief cycle, and there's an increasing need for emotional support. In the diagrams that I found, actually, there was this first one in the upper left-hand corner of your screen is from Grand Valley State University. And some people put depression before bargaining, and some people put bargaining before depression. As you'll even see in the bottom left-hand corner, those two are reversed. And so I think that illustrates that there's flexibility with how people approach grief and how it's experienced by each individual. But this is where perhaps someone's trying to make sense of the situation or the circumstance that occurred. There's the need for communication and support, reaching out to other people, or recounting the event and retelling the story. How someone might process that situation can lead to a feeling of depression. And depression is more than just a feeling. It's also a physiologic response, and it can be a medical response, as we were talking about before. And we'll talk about how we classify depression and the associated stress that can go along with that. But depression itself can manifest itself in a number of ways. And there are a number of symptoms that as medical providers, we look for in terms of depression, both subjective feelings that a person may have in terms of their feeling like it's difficult to do normal activities of the day, and then also perhaps an outside observer's understanding of how the person is responding to a stressor or to a grief circumstance, in terms of if a family member or if a friend comments on the person being either less active than they used to be, if that person tends to have difficulties in their relationships with others. As a medical provider, we can also look at objective data for depression, such as, has the person lost weight in a short period of time? Have they gained weight in a short period of time? Are their sleep cycles disrupted? And some of those things that might be more objective measures in addition to what the person who is experiencing the depression is actually reporting. And then on the grief cycle, there is a hope that we move toward acceptance. And acceptance not in the sense of moving on, or acceptance in the sense of reverting back to denial, but acceptance in terms of the grief experience becoming part and forming who we are moving forward. And I liked this stages of grief graphic that's from speakinggrief.org in the left-hand bottom corner, which says, we can lay out a nice roadmap for grief, but sometimes the road that we take through that process may be more circuitous than the nice diagrams would lead us to expect. The other thing that I want to say about grief before we move on to the next slide, and I'll share a little bit of my own story, is that grief is something that is individual, meaning that we experience it in our own bodies, in our own minds, in our own hearts. Yet it's also a shared experience. And so it's even shared. The picture that I have in the upper right-hand corner is a picture from the animal kingdom. And as was mentioned in the introduction, I am originally from Washington State, even though I currently live in Grand Rapids. And while in Washington, there are pods of orca whales. And there was a marked event a few years back when a new calf was born to one of the orca whale pods. And unfortunately, approximately half an hour after this new calf was visualized, it passed away. And there was a 17-day period in which the mother orca whale was observed pushing the calf through the water, even attempting to feed the calf, and basically keeping the calf by her side and going to great lengths to do so. And it was one of the most marked observers. National Geographic and national and international news outlets picked up on this story because there has been a question of, is grief, how widely shared is the grief experience? We know it's shared among humanity. Is it shared in the animal kingdom as well? And I just point that out to say that our biology and our psychology and our spiritual and mental approaches to grief, I think, are integrated. And it's important to view all of those different parts as a whole. And especially as humans, as we are sharing our grief experiences with each other, to realize that while grief has the potential to be very isolating, it also has great potential for there to be common bonds and to be community that is forged in the midst of that grief. And I think as we as a nation are going through and hopefully recovering from, I'm not sure we're actually at the point of recovery yet, but I know as healthcare providers also who have all had our different experiences of the COVID-19 virus over the last few past 2 years, that grief is experienced in markedly different ways based on how different people have been impacted. For some people, that grief has been loss of expectations. For my own son, he lost his high school graduation. In the midst of someone losing a family member, that seems very like a minor circumstance, right? A high school graduation, he was 18 years old at the time, and he has many years ahead of him, compared to someone losing their physical life and never having another experience. That seems like a small price to pay. Yet those grief losses of significant life events, I show a picture here. This is actually my husband's high school graduation. These events are monumental. And I mentioned my husband's graduation because from high school, which was a number of years ago. But I mentioned that because both of his parents who were present at that momentous event, they are no longer with us. And for both of them, their death experience was different. And there's a lot of grief that persists as a result of that to this day. But yet we look back on momentous events such as this one, and we feel the joy of those shared experiences as well as the grief at that time. So I just wanted to give some first examples of, as we're talking about seniors and being well, kind of the, I think, mixed experience of being a senior. My mother-in-law, who is pictured here at the graduation, she died when she was 58 years old of cancer. So we never really reached the point where she would have been considered a senior. My husband and I, before we moved to Grand Rapids, were both in the area of high school work. We both worked in youth centers with nonprofit organizations, and then we worked most recently as high school teachers before coming to Grand Rapids. And we at times worked with high school students who lost their parents before they ever became seniors. And I remember one high school mom who was in the midst of her battle with breast cancer saying with me, you know, I'm 46 years old and some of my friends are bemoaning the fact that they're going to be turning 50. And she said, oh, what I would give to make it to 50. And I was 30 at the time. And that statement really stuck with me as a young adult who was starting a family of my own at the time, because I thought, what a unique perspective that is, to think what a gift that I might have the opportunity to make it to 50. And I think of that when I think of seniors being well. I think what a gift we have in our community, both for families such as my own, as well as for those of us around us, to be able to spend these years with our elders and those who are there to pass on wisdom to the next generations. And I point that out because directly adjacent to the picture right here in the pink top, this is my grandmother. She is now 94 years old, and she lives with with my mom and dad in the Seattle area. And she recently lost her sister at the age of 96. And I said to her, you know, Grandma, I understand that you got to see Aunt Ellis before she passed away. How are you doing? And my grandma said to me, and my grandma also does struggle with dementia, but she said to me very plainly, she said, I'm doing bad. I really liked her and I miss her a lot. And so even the privilege of living to the age of 94 or the age of 96 as a senior does not diminish that grief or that loss of a life that is shared or of that experience. And so I think while we recognize the privilege that it is, and hopefully those of us who are in the younger generations recognize the privilege that it is to have our elders and our seniors who are imparting wisdom to us, that we also don't minimize the unique experiences of grief that are more prevalent with the loss of friends and family members and significant others or spouses during these years, and that is an increased prevalence. For my grandma, the loss of mentation has also been difficult, and that can be a grief experience as someone is going through it as well. And so one of the things that we have been working with her mental health, stress, and mood is identifying with memories that she does have that we can still relate and share with her. The other thing that I want to talk about with grief is that sometimes we have a loss due to absence, as I mentioned earlier, perhaps a parent that we never knew or a sibling that we never knew throughout our life or for which we had a broken relationship. And I wanted to just mention in the bottom right-hand corner, this is a woman, her name is Ana Paredes, and she is an Ecuadorian woman. My family and I lived for 5 years in Ecuador, where we taught at an international school, and we were away from family and many of our friends in the United States during that time. And this was a family of seniors that welcomed us in and watched our dog, they watched our kids, they welcomed us as family. And so I also wanted to mention that during these times of grief and loss, there are other people who beautifully step in to not occupy the same spaces of perhaps ones that have been missing, but they also fill spaces within our hearts and within our lives that are also part of that grief process. And then the last picture over here on the left that I just wanted to point out, that is those are my parents on their 50th wedding anniversary. And so I was just bringing that up because this is a time where strong relationships are celebrated, but also when those relationships meet their end through whatever means they meet their end, that can be a difficult time of grief as well. Any comments on grief before I move on to the next section, which is on stress and when stress can become a bit overwhelming? Just wanted to take a moment and pause if there are any comments or reflections on grief. Okay. So this next section that I wanted to talk about is a little bit of the biology of stress. And I had the privilege of learning under a professor in college. His name was Robert Sapolsky, and he wrote a book called Why Zebras Don't Get Ulcers. And the main point of the book is that stress is meant to be a short-term response. So the homeostatic imbalance that I described earlier is the body's natural way, whether emotionally or physically or both, of responding to an external stressor. But when stress becomes long-term, when it becomes something that is overwhelming, that is when we start to see negative effects, both emotionally and physically, that lead to the need for what we might call stress management. So his quote here is, "We have evolved to be smart enough to make ourselves sick." The point being that throughout the course of human history, the primary cause of ailment used to be infectious disease, or, in going way back to the cave person era, a zebra getting eaten by a lion or another predator. And so you needed your body's stress response in order to escape, to run fast, in order to fight off an acute illness. And we even see this in the midst of our COVID-19 pandemic, where we're really dealing with an infectious disease in the midst of a vulnerable population. We have grown accustomed in our developed world to disease being a long process. And the stress response of acute illness being a short-term process is something somewhat new to us. And that was how it was originally biologically developed. So I called this slide "Why Doctors Use Prednisone," and I want to talk just a little bit about how our bodies respond in a stressful situation, both in the short term and also over a more prolonged period of time. So the main stress hormone in the body is something called cortisol. Cortisol is a hormone that's secreted by the adrenal glands, which sit on top of the kidneys in your lower back. If you just kind of reach around and you give yourself a little massage in your lower back area, you might be able, hopefully you shouldn't feel too much pain, because if your kidneys are sore, that's not a good sign. But that's where your kidneys are located, and your adrenal glands are small pieces of tissue that sit right on top. And they secrete a very powerful hormone called cortisol. Prednisone, which you may have been prescribed in the past, is a synthetic version of the body's natural hormone of cortisol. So when you have a stressful situation that's interpreted by your brain, the master regulator of your body's balance, or the homeostatic balance that I was talking about earlier, is a small portion of your brain that sits right behind your nose, and it's called the hypothalamus. And the hypothalamus takes input both from our thoughts, our emotions, and our feelings. It also takes input from our brainstem and things like our respiratory rate, our heart rate. It takes input from our sensory receptors and our temperature that can go up when we have an illness. And in response to these different inputs, the hypothalamus communicates both with that large, I'll see if I can use my pointer here, kind of teardrop shaped organ right here in the middle called the pituitary gland. In real life, it's about the size of a pea. And it sends out signals both through the nerves of the body and through hormones that eventually communicate with those adrenal glands sitting on top of our kidneys to secrete cortisol. Well, what does cortisol do? in our body. The other hormones that are secreted are also, you might have heard of these in the fight or flight response. They're epinephrine and norepinephrine. And these are what we might think of as our fight or flight hormones. And together, these hormones together can all increase our heart rate and our blood pressure. They raise our glucose level in our bloodstream so that we have energy to respond quickly to stressors, or to even think in a more focused way. They're going to increase blood flow through the vessels of the body. And might even make us feel a little bit flushed, and we might notice that we feel nervous or anxious. But over the long term, what happens if this stress response isn't calmed down after that initial stressful event? If we're experiencing grief or we're experiencing stress over the long term, that sugar and that elevated heart rate and that increased blood pressure, it can make our arteries get more stiff. It can make our heart have to work a little bit harder. It can retain water and salt in our blood that increases our blood pressure and puts more pressure on those vessels that carry blood to the rest of the body. And it can also, through those increased proteins and fats and sugar that's circulating through our bloodstream, it can even contribute to long-term conditions like diabetes or weight gain. And cortisol, like I was mentioning before, can also suppress our immune system. So this is one of the reasons why we use cortisol, or we use prednisone, or you may have even heard of dexamethasone, as treatment for conditions like when you have an acute flare-up of asthma, or maybe you've had an acute flare-up of COPD or chronic obstructive pulmonary disease. We use these strong stress-related hormones in order to calm our body's immune response, because the immune response is something that is really is not needed in an emergently stressful situation. But over the long term, if we suppress our body's immune response for too long due to prolonged stress, that's when we become more susceptible to our bodies getting ill and getting sick, and having weight loss or other adverse effects over the long term. So that was my little biology lesson back from my teaching days. So short-term stress responses are adaptive when our body is out of balance, but long-term stress responses over the long term can ultimately be maladaptive, suppress our immune system, and actually make us less well in the long term. So what are some methods we can talk about where we might manage stress? And what are some opportunities that are available here in the community? There's a few that I just want to share about with you that I've been researching somewhat myself this week. And I kind of divided these stress management techniques into two different categories. The first are things that I might call internally focused, or things that we might consider self-care is a popular term for this. And these are important, and they're also things you can do at home. So the first one are deep breathing exercises. I'm going to take us through one here in just a few minutes. But this is basically where you take a deep breath and you inhale, and you're going to exhale at a much slower rate while you're paying attention to your heart rate. You're really cleaning out all the lobes of your lungs and getting maximum gas exchange. Exercise is a very common one. Exercise can be anything from outdoor exercise where you're walking, you're running, you're swimming, you're participating in an exercise class. Exercise can also be something that is performed while you are sitting in a chair. There are many videos and helpful classes that are even called like Sit and Get Fit, and they're movements that you can do in a reclined position, or even in a supine position where you're lying on your back. The other thing about exercise is there are mental exercises as well that can aid in stress management, whether these are memorization of favorite poems or songs. But mental exercise, I always like to point out, as another option. Nutrition is something that I'll just show you a website that's federally sponsored here in just a bit, Medline Plus, that has some great nutrition tips. But we really underestimate nutrition as a major role in our daily existence. If we are particular about our medications and what time we take our medications and how often we take our medications and our consistency, I think how much greater attention should we pay to our nutrition, which is something that we put in to nourish our bodies at least 3 times a day, often more. And I think we often underestimate the value and the importance that can have in lives. Sleep, I'll talk about sleep hygiene and how we can manage our sleep and wake cycles. Counseling, where we're doing one-on-one, that can be something that's internally focused as self-care, but it also can be externally focused as we're interacting with another person. And then medication support. And I like to call it medication support. And some people say, why do you add that extra word of medication support when we're talking about stress management? And that's because if we're going to use pharmacologic therapy to aid with stress and to aid with anxiety and with our mood, first I want to reinforce that in many cases that is entirely appropriate. And I think there's been a very good destigmatization of the use of pharmacologic therapy, especially for longer term mental health conditions. However, I call it support because I like to dispel the notion that there is a magic pill in order to alleviate stress management. And I think it's important that we consider that stress management is very holistic in its approach, and that medication can be used as a support, but not as a wholesale solution. So internally focused self-care is one important part of stress management. But a second part, and this is where I really like to emphasize different opportunities, especially for seniors, is that in our society, I think there has at times been a devaluing of the role and the incredible influence that seniors play in all of our lives. When my husband and I worked with youth through nonprofit organizations, whether it was churches or youth groups or in schools, sometimes we would have retired individuals come up to us and say, well, I don't know if I could lead a group of teenagers. They might think that I don't have anything to offer. They don't think that I can speak into the relevance of their lives. And I just want to dispel that notion. Having spent 20 years working with teenagers and currently having almost 3 of them in my own home, I want to encourage those of you who are seniors and listening to this presentation to not underestimate the acuity with which teenagers and young adults listen to the words that you are gifted to impart into their lives. And we saw incredible relationships between seniors and teenagers throughout our years of working with youth, in which, whether it was something as simple as working in wood shop, or whether it was with a small group where someone shared their life experience in a way that there was a lot of shared collaboration and just admiration for the wide variety of experiences that others have had that can reset the frame of what someone thinks is normal or what someone thinks is shared experiences are powerful. And so we saw some beautiful relationships throughout our time working with teenagers on a daily basis. Another way to reach out is through shared meals in the community. This can be with people that you know or in your neighborhood. It can also be with larger organizations. Mel Trotter, for example, which serves people who are experiencing homelessness in our community. They serve lunch for approximately $2.50 most days, and it is open to anyone in the community who wants to come by and have lunch in their dining hall. Volunteering, I already mentioned some youth group experiences that I have had. Our public schools, as we are going to be moving out of the COVID era, hopefully within the next few months, but we can't make that call too soon. But our public schools are always looking for mentors and for volunteers within the classroom, whether it's to work with children one-on-one. There are also organizations that I just want to mention that I have some pictures from here. This picture was taken from a website called Mothers of Preschoolers International. There are local chapters here in Grand Rapids. This is an organization that reaches out specifically to mothers who are raising young children, and they specifically love to have seniors in the community come to volunteer and provide childcare during their sessions. So I wanted to mention this picture was taken from their website. If you have more difficulty with mobility and it's hard for you to get out of the home, I also wanted to mention opportunities for letter writing. I actually just went by the county correctional facility off of Fuller Avenue earlier this week, and currently they do not have an established letter writing program, but there have been programs such as this in other parts of the community where there are portions of our society of people who feel forgotten. And these can be people in a correctional facility. These can be people in adult or youth foster homes. These can be people who are in senior homes or in subacute rehabilitation or long-term assisted living facilities, who are looking for someone to say, I would be interested in your story. I want to get to know you. You're not forgotten. I'm thinking about you. And this is something that I think for stress management helps divert the focus from our own stressor and places an interest in another person. Working inside or outside the home, I'm going to show a couple videos in a little bit that talk about other members of the community who are part of the West Michigan 60 Strong and ways that they still contribute, either through paid work inside the home or outside or on a volunteer basis. I put prayer here as an externally focused activity because this is something also, depending on whether you have a religious persuasion or not, whatever spiritual affiliation you may have, I wanted to at least mention this as an option because there are religious organizations in Grand Rapids that take requests from people in the community for things, again, that they would like prayer for. And they will give those lists only to individuals who have requested it, so that people who maybe have trouble getting outside of their home again, but still want to contribute in a way of letting people know that they are thinking about them or that they are praying for them, that is also an option for community involvement. I also went by the Kent County Animal Shelter earlier today and asked what volunteer opportunities they have. The animal shelter in Kent County is run under the direction of the health department, and they are in need of volunteers who are willing to walk the animals that they have currently under their care. They're also looking for longer term homes in terms of foster care for briefer periods of time or longer periods of time through adoption care for mostly cats and dogs, but occasionally other animals as well. So I wanted to mention all of those options for stress management, both the things that we can do internally and externally as options for kind of restoring some of that balance that we talked about in our own lives. Okay. This is just an exercise that I thought I would take us through just for a couple of minutes online. This is something that activates what is known as the parasympathetic part of our nervous system. So before, if we were talking about the stress response as the sympathetic or this fight or flight part of our nervous system that responds in the form of an acute stressor, I think it's also valuable to know how can we turn that system off? How can we activate perhaps the more parasympathetic part of our nervous system, which helps us calm down, helps us rest, and helps us come back to balance when we're recovering from a stressor. And just like as a teacher, I might train my students to learn science or to learn math, or my husband trains them to write a wonderful literature or read a work of great literature, write a well-formulated essay, we can also train our brain and train our stress responses as well. So one very simple way that I just want to guide you through is to go ahead wherever you are and take the time to place your hands on your belly. And I want you to take a deep breath while counting to 5. And when you get to 5, I want you to pause just for a moment and hold your breath. If you do have a cardiac or a pulmonary condition, you don't have to pause and hold your breath. You can move immediately to the exhale phase. But in that moment, after you inhale, I want you to kind of take a pause where you let your shoulders drop and make sure that your shoulders are not up by your ears. Exhale for twice the amount of time that you inhaled, and then take another pause. So we'll go through that together. And so I'll just kind of talk you through it. Go ahead and place your hands on your belly. And I want you to inhale, counting to 5. 1, 2, 3, 4, 5. Take a pause, hold your breath, drop your shoulders, and exhale. 9, 8, 7, 6, 5, 4, 3, 2, 1. And you can take another pause. If you'd like to do that again while I'm talking, you may. I highly recommend it. But that is something known when you take the breath and then you pause and you hold it for a moment. That does do something that's similar to what we call a Valsalva maneuver, which is where you're increasing the pressure inside your lungs and inside your rib cage. And your blood pressure momentarily drops before it normalizes again. And that's what this graphic is showing on the right side of your screen, is that your blood pressure, so this represents the black jagged line represents your blood pressure kind of going up and down as your heart pumps. And it does a gradual drop kind of in this middle phase before it normalizes again. And so that can be a helpful exercise just to reset your nervous system. And it's something very simple that you can do at home or in the car or at any time that you find yourself desiring to do some deep breathing exercises. Another thing that I wanted to mention as part of stress management and nutrition, I wanted to call attention to Medline Plus, which is an organization run by the federal government. And it also it's a wonderful resource for a variety of health information. And I'm just going to switch over really quickly here to away from the PowerPoint to this website. Sorry, as I just kind of move around a little bit here. But I wanted to show this. Are you able to see this here on the screen? Let me just make sure that I'm okay. Are you able to see this here on the screen? I'll take that as a yes. Good. So Medline Plus, like I mentioned, it's run by, it's .gov because it's a good source run by the federal government. Depending on your views on the federal government, I tend to be fairly trusting. But it goes through a variety of health topics, drugs and supplements, if you have questions about any medications that you're taking. And then it also has a section from which I pulled that recent image that goes through cooking and nutrition and gives great recipe ideas. So down here, healthy recipes. If you're someone who does cook at home and perform some of those activities of daily living, or even if you get your food from another source and you have some choice over what it is that you are consuming, there's some great ideas that are listed here. While I am on this page, I'm also going to show, these videos were a little bit choppy earlier, but I want to take the opportunity just to talk about, or just to show some videos of others in our community and what their experiences as seniors being well has looked like, and also potentially just provide more community connections for those of you who are interested in pursuing this further.
This is News 8 Daybreak from Wood TV.
A group of 12 local seniors are being featured in a calendar called West Michigan 60 Strong. The goal is to inspire others their age how to show strength in the face of adversity. News 8's Dana White spoke with those behind this initiative. Good morning to you, Dana.
Tom, good morning. The goal of the 60 Strong program is to inspire seniors to prioritize their health. Lloyd Kilgore is one of the ambassadors, and he was the first person in his family to graduate college. He's now a middle school gym teacher at Burton Middle School in Grand Rapids, and he says his big thing is prioritizing physical health by biking, playing with his grandchildren, and being a referee for high school basketball and Little League football. Kilgore has suffered from a few orthopedic injuries, including having to have 2 knee replacements. His message to other seniors: to take care of yourself.
If there's something that's not feeling right, or you feel like there's something not going right in your body, get it checked out. Your doctor is probably your best friend as we age. Healthcare is so important. So make sure you stay abreast of that.
West Michigan 60 Strong is about saying I can rather than I can't. It really is a program to inspire local seniors and people of all ages to prioritize their health and give back to the community.
Each calendar is $15, and we have more information on how to buy one on woodtv.com. We're live in Grand Rapids this morning. Dana White, News 8.
Okay. I wanted to play one more short video here. And I will just make sure that we have this. Okay, good. I'm going to play one more short video. This is also about a minute long, and this highlights
what if
one
you
of.
Get rid of your kitchen garbage at the push of a button.
Oh, okay.
Hey, I'm Matt from Pila, and I want to introduce
Here,
you to my
I'll
friend
play this one right here.
At Pila, we're a team of.
Okay.
Living in the hood or the ghetto, but I had a bunch of teachers and friends help me out along the way with clothing, food, definitely helped me on the right path. And I'm a physical education teacher, and everyone thinks all we do is physical stuff, but I teach life lessons. I mean, there's so much stuff that I talk about to them that I don't want them to go down the wrong path. My advice to people that are 60 and over is try to watch what you eat. Make sure you get up every day and do something active. You know, I mean, a lot of people I know that are retired and they sit around all morning, all day, and then maybe do something later on. But I try to get up early in the morning and make sure you see your doctor for that annual checkup every year. I'm Lloyd Kilgore. I'm from Grand Rapids, Michigan, and I'm 60 strong.
Okay. I'm going to go back to the, I'm just going to go back to the slideshow, and I'll finish up and leave a few minutes for questions here at the end. So, all right. Oop. I'll have to go back down here. Okay. Are you able to see the slideshow back up again? Let me do. Okay. New share. Right to here. Okay. All right. Hopefully that took me back to the slideshow here. And I'm just going to wrap up in a couple minutes here. If all of these methods are insufficient, you're going through grief, you are in a situation of stress, and stress management techniques, maybe they are working or you are getting some relief, but you're thinking, I need some additional help and I need some support. Please do not hesitate to reach out. As medical providers, that it is our privilege and our responsibility and our joy to walk alongside people through their journey, whatever that may be. When you come into a physician's office and you're seeking mental health support, one of the things that you can expect is the use of something called a screening tool. One of them that we use to screen for depression, and you can look these up online and even take them yourself if you would like to perform self-screening. One of them is called a PHQ-9, a personal health questionnaire that has 9 questions that ask both questions about how you're feeling on a regular and a daily basis over the course of a 2-week period. And they also ask questions about how others may have perceived you doing over the last 2 weeks. GAD stands for Generalized Anxiety Disorder, and that's a 7-question screening tool that is used just to measure an overall level of anxiety. CAGE is an alcohol assessment tool that looks for signs of addictive behaviors to alcohol. And you can use these screening tools, like I mentioned, at home, or if you come into the office seeking mental health support, you could expect to go through one of these questionnaires. We actually in our office give these to almost every single patient. We give at least a portion of these mental health screening tools because we think they are that important. And so one of the things that we do as practitioners is we use that score not as an absolute judgment, but as a guide to talk with a patient about what further forms of therapy may be most helpful. If you were at the point with mental health where you were having intrusive thoughts of harm to self, to yourself, or to others, or if someone expresses this to you, this is a time when we want you to call your provider right away. Or also there is a suicide hotline that I do not have the number up here currently, but perhaps we can talk about that in the chat in just a few minutes, where as providers and as a community, we want to be united in destigmatizing intrusive thoughts of harm to self or others, and encourage people to come forward with those thoughts and those feelings. Other warning signs that we look for are things of interference with activities of daily living, unintentional weight loss is another thing that we look for, especially in older adults. And then if you just want or need extra support, we are there as providers for that as well. We're short on time, so I'm not going to spend a lot of time going through the pharmacologic therapies that as physicians we use in mental health situations. But if you come to your provider and you're interested in seeking mental health support, the first thing that I want to say is that we employ a technique called shared decision making, which means that in some cases, using medication is entirely appropriate and helpful. And in other cases, there are people who want to pursue non-pharmacologic therapy. And so we as providers talk through with patients what their preferred approach is, and we might make a recommendation based on what we have seen or what the presenting symptoms are. So I listed some non-pharmacologic therapies on the left, and I listed some of the recommended pharmacologic or medication therapies on the right that are recommended by the American Association for Family Physicians. And these are often medications that we start with. If you have more specific questions, I would be more happy to talk about those. We do not generally recommend medications that fall on the list of what are called the Beers criteria. And these are medications that are recommended by the American Geriatric Society as being more dangerous in older adults due to increased either memory loss, increased fall risk, or impaired ability to operate a motor vehicle. And so if there are some medications that your physician is resistant to, it may be because they meet those criteria. We also do not recommend the use of substances such as marijuana or alcohol because of the increased risk of impairment as well. Last but not least, I wanted to show a picture of my own, a known dear senior in my life. This is my mother, who with 2 hip replacements still manages to do a large amount of hiking through the mountains of Washington state. And so this is she and I on a hike together. And I wanted to just close with a quote that is actually from Winnie the Pooh, which I think is maybe dear to many of us who have gone through those phases of life. When we're talking about grief, we're talking about stress management, we're talking about mental health and mood. I wanted to close by saying how lucky I am to have something that makes saying goodbye so hard. And I am thankful for the many years that I have spent with dear ones in my own life, as well as the privilege of meeting some of you even virtually to talk about how we can walk together through these experiences of grief and stress management and mood and ultimately wellness. So thank you for having me.
Well, thank you very much, Dr. Becker. That was an awesome presentation. We really appreciate having you to teach us all about a wide-ranging and very important topic. So what we'd like to do now, if anyone does have any questions, I will reclaim the host, and I will be able to, if anyone wants to raise their hand, I'd be able to open up your ability to chat. So I'd be happy to if anybody has any questions for Dr. Becker, we have the space for that now. So. Oh, thank you. Thank you very much, Ms. Paul. She says, thank you very much. Very informative. No questions. All right. Oh, there you go. And also never let anyone tell you it was too technical. I understood it all, even though a computer programmer. There you go. Well, thank you very much, Mr. Peel. Appreciate you coming. All right. Well, Dr. Becker, it doesn't look like there's any questions. I'd like to thank you all for coming today. One thing to mention in that a short half hour, the exercises that Dr. Peel spoke to for low impact exercise class for seniors, that will be coming up. So, stay, don't touch that dial, as it says. And we will be discussing also over Zoom the book, The Year of Magical Thinking by Joan Didion. That's coming up at 2 o'clock. So, and I'll be leading that, and I'm really looking forward to discussing that book because it makes real, emotionally speaking, a lot of the things that were discussed here with that Dr. Becker was discussing. So thank you all very much. Hope to see you for our later sessions, and have a great day. And thanks again, Dr. Becker. Excellent presentation.
Oh, thank you so much for having me. I really appreciate getting to be a part of it.